Hello everyone, and welcome to this audio podcast. This audio podcast is as part of the ShiZMode Chapter. This audio podcast as part of the analysis and expose in logistics. This audio podcast as part of a shitstorm motley and a jump off. This audio podcast as part of a segment and V2, and this audio podcast as part of a storm logistics production. Through this audio podcast, and I'm looking at sort of in around the methodology. So data have been utilized for analysis, and this was provided by the tech by and through the collaboration through their medicines tech at the time in around where the collaborative was in around 2019. The medicines were actually coded, or the drug treatments or treatment modalities were coded using the dictionary of medicine and devices. The medicines included sort of the nephrotoxic medicines and medicines that require dose adjustment in amongst where renal disease or renal impairment. And around renal impairment and amongst databases that were also based on sort of investigations through the literature, for example, by papers by Foon in 2012. And Fowl and Lee in 2007. The drugs or the treatment modalities were also grouped or categorized by and through the utilization of the British National Formulary or BNF, and the BNF categories for nephrotoxic medicines, which were grouped into four particular categories. That is diuretics, angiotensin converting enzyme inhibitor or ACIs, NSAIDs, and treatments in line to treatments of severe or important infections, and where particular antibiotics such as gentamicin being categorized as a nephrotoxic sort of antibiotic in amongst the British National Formulary. That draws this audio podcast to a close. The next audio podcast will look into the aspects in line to the analysis.